Right, a warm welcome from Geneva, Switzerland. I'm Reda Sadki of the Geneva Learning Foundation. With me is Charlotte Mbou from Ebolova, Cameroon. What's it like today in Ebolova, dear Charlotte?
Thanks, Reda. The day started off with some rains, but right now the weather is quite cool and so beautiful. And it's a pleasure for me to join all of the Teach to Reach community, the Teach to Reach family that's gathered here for this lightning chat as we count down to Teach to Reach 10.
All right, and we also have, so we still don't have a card for you, Maria. We have to make one. Maria Manzan from Corrientes, Argentina. Would you like to say hello?
Hello, Rita, and hello, Thoko, and everybody that is joining us. It's a pleasure to be here. Thank you.
And of course, we're here with our guest, Thoko Elphick-Pooley. She's the Chief Executive Officer of Uniting to Combat Neglected Tropical Diseases. We'll be discussing climate change and neglected tropical diseases. NTDs is the ugly acronym, and we'll be exploring and learning together with participants in the room, Teach to Reach participants who will be sharing their experience in dialogue with Thoko. So we're very much looking forward to that. You can see, based on the countdown, we're less than a minute away. So we're going to change the mood a little bit for the last 45 seconds. And we'll be kicking right off. If you are watching on YouTube, LinkedIn, Facebook, Twitter, X, wherever you are, let us know so you can not only say hello, but actually participate by sharing your questions, comments, feedback as we go. A warm welcome from the Geneva Learning Foundation in Geneva, Switzerland. Charlotte Mbou and Maria Manzan are my co-hosts for today's, and this is the first of a series of lightning chats. You're going to meet Thoko Elphick-Pooley. Today, and we're going to explore the issues around climate change and neglected tropical diseases, and the particular role of health workers within that. And first of all, Thoko, by way of introduction, this is what you told us about partnering with the Geneva Learning Foundation. You said it opens up a vital channel for us to hear directly from frontline health workers about the challenges that they face. Now, there are health workers participating in Teach to Reach in the room with us. What would you like your first words to the folks listening in who are going to be sharing their experience today? And a warm welcome to the Teach to Reach family.
Excellent. Thank you so much, Reda. I think my first few words are really thank you, because neglected tropical diseases are powered by community health workers. They are the engine of what we do. So really, thank you so much for having us. And it's an absolute pleasure to join the Teach to Reach family this afternoon for this discussion. So really, I'm filled with gratitude to be in your presence today, given all the work that you do.
Thank you so much, Thoko. A warm welcome to you as well. This is the first of a series of lightning chats. We have a complicated and changing schedule, so we're not going to give dates and times, but if you register for Teach to Reach, you'll be invited to meet Renzo Arginto, who's a specialist and a leader on planetary health, Ravati Falki, who's a leading light on climate change with respect to maternal, newborn, and child health, Maria Nera from the World Health Organization, who leads the climate change and health at WHO. Also, Kate O'Brien on climate change and immunization. She's the director of immunization at WHO. And then other Teach to Reach partners from eHealth Africa, David Akpan on digital health, and Luchuo Ibain on climate change and decolonization of global health. So before we dive in with the questions, Thoko, in July 2023, 4,700 health professionals from the Geneva Learning Foundation's network gathered together for a special event about climate change and health. And we asked a series of questions, and the people who joined, most of them said that they're part of the family or a trusted friend. And when we asked, is climate change a threat to the health of the community I serve? You can see the red is bad. It's the highest threat level out of 1,234 respondents. And most health workers also told us that they worry about climate change and health. Now that in the past we had already at Teach to Reach discussed female genital schistosomiasis and heard about actions led by health workers in local communities to take on FGS. This led us to neglected tropical diseases and to really putting together with Uniting to Combat NTDs in partnership, NTDs at the heart of the Teach to Reach agenda. So that is how we got here. I'm now going to turn to Charlotte for the first question to our guest, Thoko.
Thank you, Reda. So, Thoko, I would like to find out, first of all, why should we care about the 21 neglected tropical diseases? These are not the world's biggest killers. So what makes them such a critical global health priority?
Excellent. This is a great question. For me, neglected tropical diseases, the diseases are quite different. You've got parasites, you've got viruses, but what really brings these diseases together is who they affect. They are diseases of poverty. They affect the poorest people on our continent, particularly in Africa and everywhere else in the world. So for me, it's not really caring about the diseases, it's caring about people. So if we care about people, we will care about these diseases that continue to trap people in cycles of poverty. They have a huge impact on individuals. They disable. You talked about these diseases don't kill, but actually your life can be completely turned upside down. You may be disabled permanently from these diseases such as elephantiasis and leprosy. Your child may be unable to go to school because of poor health caused by these infectious diseases. And when you are in that situation, your ability to learn at school, to progress, to get a good job is severely affected. And we know that if you are unable to work, it has other major impacts, including on our economies on the continent. So it's really not caring about the disease, it's caring about the people that are affected. That where we have these diseases that perpetuate cycles of poverty really are damaging on our continent, we would want to get rid of them.
Thank you, Thoko. Over to Maria Monzon for the second question we've prepared for you. And this is really to open up the gates. If you have a question for Thoko, if you have a comment, something, an experience you'd like to share, please raise your hand. I see we already have in our Zoom studio raised hands. If you're listening on YouTube, Facebook, Twitter, X, wherever you are, you can type your comments and we will share them with Thoko. We have actually a couple of comments. We have Esther Yusuf Yakubu from Hans Plateau State, Nigeria. So who just says hello. Esther, why do you care about neglected tropical diseases? What is your experience? If you have the time to type in your experience, if you're not in our Zoom studio, you're welcome and encouraged to do that. And Samuel Y. Atiza says, great. That's a short and to the point. Samuel, but tell us what brings you here and why you care about these neglected tropical diseases. Over to you, Maria.
Thank you, Rita. So, Thoko, Teach to Reach is inviting health workers to share their experiences with specific NTDs in their communities. So which NTDs do you think are most important for health workers to discuss and why? And what insights do you hope to gain from their frontline perspectives?
Another good question. I think for me, the NTD that's most important is the NTD that exists in the community that you're in. Because for community health workers, NTDs that are a problem in your community will differ from one place to another. So, for example, in some areas, schistosomiasis, if you live in Lake Malawi, bilharzia schistosomiasis will be a much bigger problem. And community health workers really on the front lines will know how children are, how they are feeling, how women are. So for that, for community health workers, you really are the eyes and the ears of what goes on in your community. So being able to raise the alert with relevant officials that we have a problem, we are seeing cases of this particular disease, or in some cases, you may not even know what the disease is, but you may see some symptoms of people who are generally unwell. For schistosomiasis particularly, you'll start to see a high number of children with blood in their pee. So as the community health worker being able to build that pattern, you might be able to raise an alert on it. For other areas, if you're in northern Kenya or others, you might see with trachoma, which is an infectious eye disease that causes the eyelashes to invert, turn inwards, rubbing on the eyeball until somebody goes blind. That may be a priority in your area, which may not be the case somewhere else. So really for me, what we really want to get with community health workers, because you really are the ears and the eyes. You are the most important people when it comes to preventing these diseases. So where we need to get to is to make sure that you have the tools and the resources to be able to identify all these different symptoms and see which ones of them could be an NTD, so that you can be able to report this in within the relevant health officials for people to be treated. So I cannot thank you enough for the role that you play and where you fit in the elimination of these diseases.
Thank you very much indeed, Thoko. Now, over to Charlotte. I see, yes, in our Zoom studio, there's a number of people who would like to respond or ask a question. So over to you, Charlotte.
Yes, Reda, I'd like to invite Ebenezer Awine Amongba, who was the first to raise their hand. Ebenezer, are you able to unmute yourself? And please do start by introducing yourself. Tell us who you are, where you work, what you do, and the question you would like to ask Thoko today.
Good. Thank you so much. Good afternoon to everyone. I'm Mr. Ebenezer Awune Amongba. I'm the founder and CEO of the Akanyue Foundation in Ghana. I precisely work in Ghana in 5 districts. That I happen to have a project that has been funded from Invest, working on NTDs, which I'm currently working in the Brussels South district. And my question is, the project I had to work on this NTDs is limiting. This year is the end of the project. Now, my worry is going to door-to-door, DBS, volunteer training, authorities training, and many of I've realized that there is a gap behind, that you see people with such conditions. If you don't take time, you weep. I'm a physically challenged person, but it's a passion to me to like put a smile to someone. So when I had the opportunity, I said, I have to help in the Booster South district. Now, the project is coming to an end. We are going to give them a livelihood or economic empowerment skill training to the affected persons. But the question is, now the project is getting to an end. How will I in Ghana here get more fund or more support to continue to work in these particular districts that I've just mentioned on? Thank you.
Thank you, Ebenezer. Before Thoko answers that, just to highlight, many of you are who have joined our organizational leaders. We ask that you speak from your personal experience rather than about the considerations of your organization. However, this issue of funding is critical. Uniting to Combat NTDs has highlighted I believe it's $2 billion funding gap, money that's missing if progress is to be made against NTDs. So Thoko, building on what we just heard, how do you believe that the voices, experiences of health workers on the front lines, of NTDs, of climate change and health, can help mobilize resources needed to close this gap?
Sure.
First of all, thank you, Ebenezer. Thank you for your passion. You are clearly somebody who cares deeply about communities and people affected by these diseases. And really thank you for all of the work that you're doing to make sure that you can reach out to these individuals. I think you raise a serious point, which is about sustainable financing for these programs. We have seen that as a big issue, not just reflected at a district level where you are, but at national level and global level. Neglected tropical diseases, they are called neglected simply because there isn't sustainable financing that can keep these programs going year in, year out. So for us, what we think is really important, and this is where we need you, is how do we build and create this demand at the community level where you are to get these diseases prioritized at the national level, and for countries and governments in affected countries to say, these diseases are diseases of public health importance. We need resources for them and we need to fund them. One of the biggest challenges that we face, even when talking to international funders, they say to us, when we go to countries where these diseases exist and we ask them what their priorities are, neglected tropical diseases never come up as something that countries need to address. So then you see that reflected in funding allocated to NTDs. It really reflects that level of interest. So Ebenezer, you can play a really important role because you are somebody from Ghana. You live with these communities. You have seen firsthand how these communities are affected. You have played a role, and you have seen how people's lives can be changed due to these interventions. So we need for you to be a really strong advocate to help, particularly with national governments, to see how can they allocate these resources to close the gap. And I will also encourage you perhaps to go back to the partners that were funding you before, and see whether they can extend the work that you have, and offer you some more funding. And I think really mobilizing those domestic sources and thinking about some of the corporate partners will be really key. And where you can play this role is just really helping us spread this message as somebody who lives within these communities, that these diseases still exist and we need to do something about them.
Thank you, Thoko. I'm going to turn back to Charlotte. Charlotte, can you introduce Thoko to our rules for speaking in Teach to Reach?
Exactly, Reda, and I was just thinking about that. So if someone has spoken that is a man from one country, the next speaker should be a woman from a different country. And that's why I am glad to turn towards Raga Elzian, Elzian, who has their hand raised, and I'm glad to see that her video is also turned on. So please do introduce yourself, tell us who you are, where you work, what you do, and the question you have for Thoko.
Okay, thank you very much. Thank you for organizing this meeting. I am originally from Sudan, but I'm here in USA. I'm working with Interfaith Rise. It is an organization for refugees and migrant people service. I work in ELE program, program for English learning, English language learning. And I'm a public health officer. I studied public and environmental health in the University of Khartoum. And work in water resource management in Sudan for more than 18 years. So I think tropical disease is a matter of geographical location. So no need to border or political border between countries, because it needs integrated program, integrated and relevant to water resource. So it needs integrated water resource management, because it's integrated water resource management having include water related disease control. So if we find entrance, or if we find integrated water resource management way for water related disease program in this maybe political program between or diplomatical cooperation between water resources like Nile Basin or Great Lakes region in Africa, or any other basin of rivers in South Africa or East Africa or North Africa, whichever. I think this will be good for tropical disease. Thank you.
I could not agree with you more, Raga. I have actually the pleasure of visiting your country in Sudan. And one of the things that struck me when I visited were the numbers of women that work in the NTDs program. I was really, really filled with joy with seeing that, and many committed and dedicated people that work very hard in a geographic diverse environment, and they were really making good progress. So hopefully we will be able to go back and regain those positive gains that were being made in Sudan. So when it comes to the integration of water management in the fight against NTDs, I really couldn't agree with you more, because we cannot end NTDs just by providing treatment. A lot of the NTDs are really caused by poor access to good quality water and hygiene, and those things need to work hand in glove. So thinking really about that multi-sectoral approach, how do we bring in huge investments in water and sanitation in these communities in order to prevent these diseases? If you look at a disease like trachoma, for example, the strategy which is recommended by the World Health Organization is called SAFE, which means surgery, antibiotics, facial cleanliness, and environment. The F for facial cleanliness requires access to good quality water to be able to wash your face in order to reduce the infection with trachoma. So absolutely, you may provide the antibiotics, you may do the S for the surgery, but without addressing the facial cleanliness and the environment, we're going to be slower and we're going to see recrudescence. So I completely agree with you, and would love to hear your thoughts again about how you piggyback on some of these big investments that you've been talking about, particularly with Nile Basin, and the fact that at the end of the day, you do have cross-border issues with these countries that need to be tackled together. So very good point. Agree with you. That's a needed investment.
That's great. Thank you, Raghav. Elsian. Now, the WHO Global Report on NTDs notes that rising temperatures, altered rainfall patterns, extreme weather events are likely to exacerbate the spread and reach of many of these neglected tropical diseases. So my next question is, and this is building on the observation from a community health worker from Ghana who said refuse dumps serve as breeding points for mosquitoes as well as cholera outbreaks. Many NTDs are vector-borne, sensitive to environmental conditions. How is your organization, Thoko, uniting to combat NTDs, our partner for Teach to Reach? How are you working to address those linkages between NTDs, climate change, and then wider determinants of health? Here we've got cholera in the mix, for example.
Absolutely. These are serious problems that we're actually seeing right now manifest themselves. Our team recently visited Nepal, and Nepal was a country which was on the cusp of eliminating a neglected tropical disease called Kala-Azar, or visceral leishmaniasis. In Africa, you find it mainly in East Africa, affecting Kenya, South Sudan, and countries in the East Africa region. In Nepal, they're observing that this disease was mainly found in the lowlands and not in the highlands, where temperatures were a lot cooler. But because of warming and degrees and temperatures going up in the highlands, which was a lot cooler before, they're seeing these diseases in places that have never been seen before. And so a country which is on the cusp of achieving elimination as a public health problem now needs to go back to the drawing board with dealing with this disease in areas where it has never been heard of. So this is really practical for communities and what this means that we are seeing today. So what really is the solution and what is Uniting doing? First of all, we are raising the alarm and raising awareness that we are seeing these diseases in places that have not been seen before. And what's really critical and required is that we need to do everything that we possibly can in these areas where the diseases exist to try and eliminate them. Because you cannot spread something that doesn't exist. So these diseases are spreading to other areas because in the areas where they are now, we're not dealing with them. So therefore, when you have these temperature changes, they spread. So that's one problem. The second thing that is required is really multi-sectoral collaboration, as you've talked about, the complexities in urban areas with the environment, wastes and garbage that doesn't get picked up, and how, poor access to water. So we really need to be thinking about these partnerships and how do we work with partners that work in other sectors, such as environment in urban areas, in order to help us manage these vectors that cause these diseases. So as an advocacy organization, we are really going to continue to raise awareness of these issues, calling for investments in elimination of these diseases with the tools that we have, and looking to forge multi-sectoral partners that can help us come up with a multi-pronged approach to dealing with these infections. So this is what I can put on the table today.
Great. Thank you very much indeed. Thoko, back to you, Charlotte, for the next question from a Teach to Reach leader.
Thank you, Reda. Right now, I am going to invite Nduka Ozo, still in efforts to respect our rules of fairness. Nduka Ozo, please go ahead and introduce yourself, and would like to hear your experience or question.
Thank you very much. My name is Mr. Nduka Ozo. I work with the Center for HIV/AIDS and STD Research in Nigeria. I am also partnering with Yakubu Gowon. Yakubu Gowon was the former president of the Federal Republic of Nigeria, who is also the Goodwill Ambassador on viral hepatitis in Nigeria. I'm going to share a very touchy experience, and please forgive me if I'm a little bit emotional.
Mm.
In the community of, yes, I'm trying to gather myself. We went to a community called Kukerita in Yobe State for an activity. And then when we got there, we discovered a family. The head of that family is 6 years old. Because they were eliminated during the insurgency in Northeast Nigeria. So this 6-year-old child takes care of. So she takes care of the other brothers who are younger. And by the time we got there to find out that the whole of them were infected with hepatitis.
Wow. And
then we were looking at how to support them. Unfortunately, there's no program available anywhere in the state or even at the national level on how to help such people. I try to be a passionate on my own by seeing what I can do for the boy by increasing his meal and supporting nutrition. But I'm not from that state. I am from the eastern part of Nigeria. So I was there for 2 weeks, and after that I left. And then when I returned back after 5 months, I went straight to the family, and they told me the boy is no more. The boy is no more. I couldn't find any other person in that family. I lost a volunteer, a 19-year-old girl, because she was infected with hepatitis and nobody's helping her. We're paying her stipend, but the stipend cannot even take care of further treatment because the treatment for viral hepatitis is very, very high. She can't afford it. And just 3 weeks ago, we lost her.
Mm-hmm.
In some areas, some young men have to go and get infected with HIV because they need to treat hepatitis. There is free drugs for HIV, but there is no drug for hepatitis in my country. So for you to get the same drug that can treat viral hepatitis, some of them get infected. They intentionally go and get infected so that they'll be enlisted to take that drug to at least manage the virus. Now, my question is, I have a lot of experience in the field, but I'm sorry I cannot share all of them here because of time. My question is, there is global fund for HIV. There is global fund for TB. There is global fund for malaria. Recently, there are funds for COVID and every other thing, global fund, global fund. NTD is something that is living with us in Africa. Why is there no global fund support for NTDs? Thank you very much.
Nduka, thank you so much for sharing that deeply moving story about this family. It's truly heartbreaking, and I can understand why you'd feel the way you feel. And for me, it just shows the utter injustice of what we are dealing with here, because this isn't a matter of resources. This isn't a matter of lack of treatment. This isn't a case of the world not knowing what to do and the world not being able to find people that are affected by these diseases. So all of those things are available. But then the question remains, why aren't some people being reached? So you asked some really good questions. And I think for me, it's about prioritization and leadership and political will. Because where there is political will, things happen. We saw even with COVID-19, in some cases, just how quickly some things were able to be put in place and put together. And I think the fact remains that prioritization in global health tends to happen based on who particular diseases affect. And this is the case with neglected tropical diseases. The fact that these are diseases of, I would say, the unseen, the unheard. So you end up with this situation where there is just no impetus to do something about these diseases. So this is where you can play a big role in the field, working to support these global advocacy or efforts that are led by people that are based in the global north. What role can you play where you are with these communities and advocate and go knocking on a minister's door? I would love for you, I'm sure Minister Pate in Nigeria would love to hear your story, what you are describing, and the fact that it is an absolute travesty that someone needs to infect themselves with HIV to receive treatment, because this is the only service that is available, that if you're affected with HIV, you are a priority, but you're not, if you're not. That is absolutely crazy that we can live in a world that perpetuates this level of injustice. I believe that your leadership in the Ministry of Health in Nigeria right now is a leadership that would be willing to listen to you and hear these things. But these stories are best coming from you, right there with the community, knowing these people, knowing these individuals, having seen their faces. So please work with us and be that voice of the community and help us really build this political will and leadership to unlock these resources that will provide the care that this 6-year-old and her family so desperately needed. So I thank you so much for sharing. I think what you have really highlighted here is the inequity and this injustice that we're living with. And I think your voice, your role can help us change the course. Thank you. Thank you so much, Nduka.
Thank you very much indeed. Now, we've heard just a few voices. We would love to hear many more. However, unfortunately, we call this a lightning chat because it is limited to 30 minutes. And it seems obvious here, but our custom is to ask the participants to type yes into the chat. If you'd like to extend, we'll only be able to go a few more minutes. But assuming that Thoko is able to stay to hear at least one more person's experience shared before we close this session. We also have a partner coordination meeting with several hundred Francophone organizations from West Central Africa as well as Haiti coming. So back to you, Charlotte. All right, so right now, thank you, Nduka Ozor, for sharing your testimonial, and you are the first one to type yes into the chat. If you don't have time and it looks like no one is typing yes into the chat, then we will be closing this session. For those of you who are familiar with Teach to Reach, you know this custom. Charlotte, is there room to hear from one more person? It looks like right now only 2 people have requested for us to extend the time. Okay, all right. Gamda Raga, thank you. And if you're on YouTube, Facebook, Twitter, X, wherever you may be, LinkedIn, please do add your yes. There's a slight delay. Charlotte, I think we'll have time for one more. To hear one more person. These are very powerful, compelling testimonials that deserve a lot more time than we're able to give them today. But that is why we hope, Thoko, that you will be with us at Teach to Reach on 20th of July for the Anglophones, on the 21st for the Francophones. Back to you, Charlotte.
Thank you, Reda. And just to say, we also have a compelling comment with a question from Habinda Mutaka Douglas from Zambia in the chat. And I'd like to turn towards Liliane Mutua. Liliane, are you able to unmute yourself? Please go ahead, introduce yourself once again, and then share your experience and or question. Liliane, I see you.
There she is. Yeah.
Yeah.
Yes. Thank you very much, and good afternoon to everybody. My problem is when we are looking at NTDs, I feel there is no proper community engagement. We are, as government, trying to do what we can through service delivery, but there isn't enough engagement with communities for our awareness. At times, we do not allow community participation and ownership into their health issue. Like in Nairobi, 60% of the community, of the population, lives in the informal settlement, where we have no supply of real safe water. You find that they have illegal connections, and the government thus says they cannot connect safe water because, first of all, the settlements are illegal. With the climate change, we're also experiencing a lot of water rationing and erratic supply, even where we have the constructed safe water infrastructure. So I think we also need to work around demand creation through awareness, through community engagement, educating people to let them know what their issues are, what are the risk factors, so that they can also look at the locally available resources and know why they pose their health to the risks, and also try to curb the risky behaviors that makes them exposed. Thank you very much.
Super. I think that for me, in a way, is a call that ends with a call to action, because this is exactly what we want. And this is why this partnership for us is so important, the partnership with Teach to Reach, because we're hoping to do exactly that. Working with community health workers, how can you help us with this demand creation and do this community mobilization? So I think it's a fantastic place to end, to say we agree with you. This is needed. That's what is going to get us to the elimination of these diseases if we engage with communities. And we're looking forward to this partnership with you all to be able to do that. Thank you so much for that great question and for ending with this call to action.
Wonderful. Thank you very much indeed. Thoko Elphick-Pooley from the Uniting to Combat Neglected Tropical Diseases. We have more lightning chats coming up. You'll have to register with Teach to Reach to see when and how to join these lightning chats with Renzo Ginto, a planetary health expert, Revati Falki on maternal, newborn and child health and climate change. She is with Save the Children. Maria Nera, climate change and health, who leads WHO's efforts on this. Kate O'Brien, looking at the connection between climate change and immunization. David Akpan, our partner, Teach to Reach partner for eHealth Africa, together with EHA clinics. And then Lucio Ebain on climate change and decolonization of global health. Once again, thank you. And again, if this leaves you thirsting for more, the best thing, all you need to do is to go to the Teach to Reach website and request your invitation. It is, of course, absolutely free for health workers from anywhere. Thank you and goodbye.